Is back or neck pain getting in the way of your life? Well, on our Bronson Health Chat this morning, we'll tell you that many spine experts Bronson has, from neurosurgeons and orthopedic surgeons to physical medicine and rehabilitation, work together to make sure you have the best approach possible to reduce your back and neck pain. So if you're suffering from a spinal condition, disease, or injury, they can help alleviate your pain and get you back to a normal routine as quick as possible. Dan Cozatti is neurosurgeon physician assistant at the Bronson Neuroscience Center in Kalamazoo, with a special interest in general neurosurgery and treating patients from cranial to spinal disorders, and is joining us for our Bronson Health Chat this morning on WKZO. Good morning to you.
Hi, nice to talk to you. Good morning.
Yeah, thanks for joining us. So, what are the most common back and neck conditions that you see at Bronson?
We see a wide variety of issues related to back and neck problems. Most frequently, we see patients that are symptomatic from either narrowing of the spinal canal or the foramen, which is a term that we use to identify the holes where the nerves use to exit the spine. This often is caused by arthritic changes, disc herniations, anatomic anomalies, instability of the spine. If this causes any kind of pressure on those nerves as they exit the spine, then you can get something called radiculopathy, or nerve pain that travels into your arms or legs. When providers refer to as pinched nerves or sciatica, this is often what we're talking about. In severe cases, narrowing of the spinal canal and neck can cause something called myelopathy, which is a fancy term that we use to describe damage to the spinal cord. This often presents as decreased dexterity and balance problems, and generally requires some kind of surgical intervention.
Is there a particular age when we begin to see some of these problems come up in our back and our neck?
Yeah, so as we age, we all develop some degree of degenerative or arthritic changes in our spines that can cause back or neck pain. You can see these signs and degenerative type changes on imaging studies as early as your early 20s often. However, we don't often see patients that become symptomatic from these changes until at least they're in their 30s and 40s. Often, later into their 50s or 60s.
Is there anything we can do, Dan, to promote back health at home and maybe head off some of these problems?
Yeah. So I tell all my patients up front the best way to take care of your spine is to maintain a healthy weight. Usually I'll tell people about 10% of staying within about 10% of your ideal body weight is a good goal. Not smoking, stretching your back and strengthening your core. Making sure that you maintain good posture and ergonomics. Also, exercises like yoga, Pilates, water aerobics, swimming. These are all great exercises to help maintain healthy spine.
Dan Cozatti is with us on our Bronson Health Chat this morning, neurosurgery physician assistant at the Bronson Neuroscience Center here in Kalamazoo. How do you know it's time to see somebody about that back and neck pain?
Yeah, good question. Back and neck pain can be severely limiting. When back and neck pain become a limiting factor in your daily routine, then I would say it's probably a good idea to start talking to somebody, go and check in with your primary care provider, get checked out. If you start developing more arm or leg symptoms, symptoms that might be related to some kind of ongoing nerve damage, such as numbness or weakness, then I would suggest being evaluated by a specialist here at the Bronson Neuroscience Center, just so we can get you started either with conservative pain management techniques, order appropriate imaging studies if necessary, make sure there's no emergent issues that need more urgent action. Red flags that would require emergent evaluation at an ER include like loss of control of your bowel or bladder, or new or rapidly progressive weakness.
Are there some spine treatments that don't involve surgery that you can perform?
Yeah. So actually, most of what I do as a neurosurgery PA is try to keep people out of the OR. Mm-hmm. Very often when patients have primarily back or neck pain without a lot of symptoms radiating into their arms or legs, or signs or symptoms that might indicate there's some ongoing nerve damage or irritation, a lot of that's more musculoskeletal irritation or inflammation. So very often we'll send people to explore more conservative treatment options such as physical therapy. We can get people home exercise programs, refer out to chiropractors, even acupuncture, traction, epidural steroid injections, anti-inflammatory medications. There's lots of different options that we try to exhaust prior to, moving straight to a surgical option.
But if that has to happen, surgery, do you have additional therapy or services post-surgery then?
Yeah. So if conservative treatment is not effective, and after having a discussion with your surgeon, and the two of you decide to move forward with some kind of surgical intervention, we'll see you back in the office at 2 weeks, 6 weeks, 12 weeks, 1 year, 2 years post-op, depending on what kind of surgery you underwent. At each one of those visits, we'll evaluate you, check in with you, see how you're doing in terms of your recovery. Often around the 6-week mark, we'll get patients started back in physical therapy to help, aid in their recovery and return back to normal activity. This is also helpful if patients need some extra work on regaining any loss of function or strength that they may have developed as a result of the nerve damage that occurred prior to surgery.
Well, hopefully we've provided some very valuable information to help many of our listeners deal with that pain in the neck that they may have had for a while now. Dan Cozzatti's been with us on our Bronson Health Chat segment this week, neurosurgery physician assistant at the Bronson Neuroscience Center in Kalamazoo. Thanks so much for discussing this topic with us this morning. Appreciate that.
Yeah, thanks for taking the time to talk to us.